I want to ask about some of these kind of side effects things that people often ask me about topical estrogen. So the most
I know where
common
you're
one,
going here. I know where you're going.
melasma.
Melasma. Well, let's talk about melasma. This is really interesting too. Do any of you know do all of you know what melasma is? It's pigmentation on the face that's used to be referred to as the mask of pregnancy. And it's a dark pigment that typically appears over the lip, but it can occur anywhere on the face. There's a lot of concern about that. And there definitely are some reports of people using topical estrogen and getting melasma. However, when it's been studied, there haven't been in these control studies, there haven't been reports of melasma. Now, that could be for a variety of reasons. Number one, it could be because people are using the estrogen for years and, for a long time, and then they get melasma, and the studies are 12 weeks, 16 weeks, 20 weeks. Maybe that's a reason. But estrogen doesn't appear, although it does drive the synthesis of melanin, it doesn't do it just by virtue of its hormone action. And people who get melasma in pregnancy tend to get it when they're on the birth control pill too. But women who've gotten melasma when they're menopausal, when they're on HRT, did not get melasma when they were pregnant or on the birth control pill. So it's really interesting. So what do I tell my patients? I say that if you tell me that you're worried about getting melasma, then here's your choice. Don't use it all over your face. I don't think I've ever seen melasma occur under the eyes ever. So I would say just use it on limited areas. And if you want, you can put some on your neck. I don't see melasma there. There are sun damage you can get on your neck, but I never see melasma.
Yeah.
If you, and let's say you don't think you have melasma, but you use it and you feel you're getting it, then just treat the melasma like anybody else would. And then if you want, stop using it on your cheeks. This is not like you have to use it all over your face, your neck, your arm. The
Yes.
areas that you want to treat. And if you have a problem, then you stop. But it's very, very uncommon. And I believe that the people who get melasma after using topical estrogen are probably those who have had it before and they know about it.
Yeah, I agree. So I've been prescribing alloy the M4 for about 2 years now, and I see patients on a lot of states. So I've prescribed a lot of M4, and I've had just a handful of people who said, after using it, I feel like maybe my melasma has been triggered, and I said, okay, that's I
Okay.
believe you. I believe women when they tell me that, and I said, okay, pause it. Let's maybe
Treat
switch
the
to
melasma.
tretinoin or stick to tretinoin. Talk
Right.
to and generally this is something that's resolved pretty quickly, and this is not a big thing to worry about in general. And to your point,
Well, let me tell you one other thing apropos of a study with melasma. There was one study done, I forgot, maybe it was 2007, I think. And there was a report of melasma of a woman who was using it on her arm. She was using it twice a day, and she was using a gel, a very high strength estradiol and estriol combination on her arm twice a day. And she developed melasma or pigmentation on her arm. This was a bad study for some, or not, it wasn't a study, it was a case report. It was bad for so many reasons. Number one, the woman was from Florida, and we have no idea what her sun exposure was. And for all we know, she put it on twice a day and sat in the sun all day. We don't know. So it's not that. It's something that happened, but you can't draw conclusions from something like that. Much like you couldn't draw the breast cancer conclusion from the 93-year-old using it 3 times a day for 75 years. Similar problem.
100%. So yeah, in general, and then in the M4 study that we did, and yes, it was short, it was 3 months long, but we saw no increase in pigmentation or any signs of that. So that was also a data point and reassuring. So when patients come to me and say, okay, Dr. Menn, I do have a history of this, but I'm still interested in giving it a try, I'm like, oh, let's try it. And you could start in a small area and just
Right.
see how it goes. That's a reasonable way. The next skin condition that people ask me about, it's something that I deal with myself, and I've actually found it to be helpful, but I would love to hear your comments on this, is rosacea, which I know is really common at midlife. So can you just tell us maybe like what rosacea is and like why it's so common, it seems, at midlife, and what are your thoughts on topical estrogen and rosacea?
Okay. Rosacea is a condition where you develop facial redness, flushing, and sometimes little pimples all over your face, but mostly in the central portion, and happens in men and in women. And it's believed to be because of an overgrowth of a certain kind of mite called the Demodex mite in the skin. And some people are prone to it, seems to be more in fair-skinned people, etc. There's lots of ways we treat rosacea. And one thing that I've noticed in my 35 years of practicing dermatology is that the more creams you apply to rosacea, the worse it is. Rosacea doesn't like to be fed because these mites, they thrive. And honestly, I see no benefit from using estrogen in rosacea. There's no reason why it should work, but if you think that your estrogen cream helps, it could be for several reasons. One being if you're using your estrogen cream instead of many other moisturizers, like let's say you use your estrogen cream and you say, oh, my skin feels so moist, I won't use my other two moisturizers that I pile on. Well, your rosacea might get better because you're using fewer
Yeah.
things on it. But I don't consider, honestly, I don't consider
Yeah.
estrogen as a
But it's
treat.
not hurting it. That's the question. People are like, I have rosacea. Is it
No,
going to hurt it? I says, no, I
no,
don't think it's going to hurt it.
no.
We know it improves in general, like the skin barrier. So like,
But rosacea is not necessarily a skin barrier problem. There's a lot of talk about skin barrier now. Every cream they're
yeah,
giving
yeah.
thick, disgusting creams. The estrogen creams we use they're not thick, slugging Vaseline creams. They're elegant cosmetic preparations that you're
Yes.
using, like the M4. And I don't,
You're
that's
not worried. Yeah.
I'm not worried, but I don't say, oh, you have rosacea, let's use estrogen. I don't,
Yeah, no, I understand that for
but I
sure.
would know, I tell people don't worry about your rosacea if you're using it.
Perfect. And I've heard some influencer doctors out there who are skin doctors who I suspect don't know a lot about menopause
Yeah. Right.
say
Yeah.
say that, well, you have to be really careful if you are going to use topical estrogen because it can cause
Yeah.
melasma, it can cause increase in
Don't
blood
get
vessels, it can cause, you have to be really careful if you have a family history of breast cancer, family,
don't get me started on
and,
this.
and
Okay.
it's like, I'm like, if you're going to give information about anything to do with menopause, you have to have a basic understanding that, we don't even deny systemic hormone therapy to people with a family history of breast cancer. To sit and scare women
It's
about
terrible.
these things, it's
And
ridiculous.
but
So,
I have my theories about that. And most of these dermfluencers, they're 25 years old. Most of them, many of them, that's not fair to say most, many of them haven't even practiced, and they earn their living not by seeing patients, but by being on social media and being supported by brands. And I can tell you now, Pfizer, who makes Premarin, is not paying influencers to talk about it. Alloy is not paying influencers to talk about it, so they don't get any money from it, and they know nothing. So suddenly, I talked about at the NAMS meeting, you started getting a lot of publicity, though I've been doing this for 25 years quietly in my own New York City practice. Now they find something controversial that has clickbait, and they're on it.
yeah,
And
it's the
the
clickbait.
rosacea one, I made a video about this, and I got a lot of hate mail, but I don't care. So don't listen to that. It's nonsense.